Are you or a loved one being treated for critical illness? Are tedious and painful symptoms from the disease or its treatment reducing your quality of life? Does it feel like you're constantly asking your care team about medication and managing the pain? Are the symptoms so overwhelming that relationships with your family and friends are becoming infrequent and strained? Do you encounter problems understanding the complexities of the healthcare landscape? These conditions can often be addressed and relieved through palliative care. Palliative care can provide support and help you coordinate care. In this second video of our education series, we will help you understand what palliative care is and how it helps people manage symptoms, who is involved, and importantly, how it differs from hospice care. Thanks to modern medicine, some terrible diseases have become preventable, treatable, or far less common. Breakthrough drugs and technologies have given physicians new tools to combat serious conditions and prolong the life expectancy of their patients. Now, people may spend months or years fighting a critical illness. As they do, they can experience painful and debilitating symptoms from the disease and its treatment. Coping with these symptoms can be so overwhelming that it makes it difficult for patients to focus on anything else in their life. When this situation arises, a better quality of life can be achieved through palliative care. Palliative care, sometimes called comfort care, minimizes pain and persistent symptoms. Palliative care is a multidisciplinary approach that uses highly trained professionals. While receiving palliative care, people can remain under the care of their regular doctors and still receive life-prolonging medications for the diseases. What is the difference between palliative care and hospice care? Palliative care is often confused with hospice, but is not the same. The concept of palliative care originated with the hospice movement in the 1960s. Over time, as more physicians and other healthcare professionals understood its value, palliative care became an accepted treatment for patients diagnosed with chronic and severe illness. Today, both palliative care and hospice care provide comfort. Palliative care can begin at diagnosis and can coincide with treatment for a disease. Hospice care includes palliative care, but hospice begins when a patient no longer seeks to treat their disease and instead focuses on comfort. How is pain managed? When it comes to medication, there are certain drugs that palliative care physicians commonly prescribe for moderate to severe pain. A good palliative care team will work with you to help find the most effective combination and minimize any side effects. Does palliative care go beyond physical relief? The physical problems of a serious illness are difficult to manage, but a serious illness affects more than just the body. It affects other aspects of a person's life as well as members of their family. Sometimes palliative care includes emotional and social support, as well as guidance on the practical issues or spiritual needs. Who administers palliative care? Palliative care is offered by hospitals, home care agencies, specialized centers, or long-term care facilities, but some providers specialize in it. Depending on the need, palliative care may be delivered by doctors, nurses, and nurse practitioners, registered dietitians, social workers, massage therapists, and chaplains. We've put together an in-depth article about palliative care on our website. If you wish to explore the topic further, click the link in the description. Now that you've learned about hospice and palliative care, you're probably wondering who is eligible for hospice care. To learn more, please join us for our next video about hospice referrals. The fact that you are exploring palliative care is a very positive sign. It means you are exploring how to bring relief to an extremely ill person and their family. The philosophy of hospice is to provide support and care so that people with life-limiting illness may live as fully and comfortably as possible. Here at Nathan Adelson Hospice, we do all we can to make sure that no one in our care ends the journey of life alone, afraid, or in pain. Thank you. If you have additional questions, feel free to reach out to us or leave a comment below.